mental health and some of the ethical issues surrounding it. Before we do start, though, could I please remind you to just keep your microphones off unless you're contributing, just so that we don't get any echoing or feedback or anything. Yeah, so the first thing we're going to talk about is health. So first of all, I wonder if in the chat you could put a definition of what you think health is, and also what you think mental health is, and kind of how they overlap. So yeah, if you could, we'll just give you a minute to do that. Just put any ideas you have, any kind of, it could just be a word or two, but just kind of a brief definition of what you think is meant by the word health. Okay, so someone's put well-being. Someone else has put state of physical and mental well-being. Okay. Does anyone disagree with those definitions? Okay, someone else has put holistic homeostasis. Very interesting. So we've got a bit more technical there. An optimum average. That's an interesting way of defining it, but yeah. Okay, so I think we've got a few good ideas here. Someone's put not affecting sleep. So yeah, okay, we've got a mental well-being and state of mind of individual and their emotional state. Yeah, so most people seem to agree that it's kind of a state of being well and being healthy. And yeah, so we've got a definition here, I believe from the World Health Organization. They define health as the state of complete physical, mental, and social well-being. So that means, your body is healthy, and your mind is healthy, and socially you feel happy and healthy as well. And mental health is kind of a subset of that, because we know mental well-being is one of the aspects of overall health. And mental health in itself refers to cognitive, behavioral, and emotional well-being. And so mental health disorders will affect these factors, and they're caused by a variety of reasons, as we'll discuss later today. But they include, societal pressure, stress, and genetic factors, and those things contribute not only to your mental health, but often in many cases to your physical health as well. However, there did used to be quite a distinct boundary between mental and physical health. They weren't both kind of the two components of health. Mental health was seen as something very different and not really seen as something medical. And that's why it's very important to recognize the significance of mental health issues, and the fact that they're no less important than physical health issues. And sometimes people will think issues like depression or anxiety, it's just being sad or worried. And in the past, these were kind of what these terms meant. But now we know that there is actually a very important chemical and physical change that's caused due to these conditions, which will affect the brain, and therefore how well a person is and their overall well-being. And there is still a stigma surrounding mental health issues, especially in certain countries. So I wonder if in the chat, anyone could give a kind of explanation for why you think that is, just a sentence or two. Just why do you think there's still a stigma? Why do you think it's kind of treated as a taboo subject? Yeah, any ideas on that?
Also, actually, just wanted to add on to that it's not all, there are certain types of people who are stigmatized against. It might not just be everyone who's stigmatized against on the basis of mental health, who is particularly at risk of being stigmatized against in particular countries, or, about having mental health issues and things like that, because it's sad to say that it does exist, but it does exist, and you need to be aware about this. Does anyone know?
To like
I don't know if you were speaking, but you've become muted, so okay, maybe not. We've got some people speaking in the chat. Someone said because people don't want to be seen as crazy. And that's, yeah, actually quite an important point. And we're going to discuss on the next slide kind of the history of mental health treatment. But it's true, in the past, mental health disorders were seen as, people were seen as lunatics. They were kind of seen as different from the rest of society. And, people, there's still a stigma surrounding that. People don't want to be seen as different. They don't want to be seen as being crazy. They want to be seen as a, valuable member of society. Yeah, so it's a lot to do with society's perception. So people have said lack of understanding on how it is such a problem. Yeah, that's very true. Some people don't really understand what causes mental health disorders and why they are, why depression is different from just feeling sad, for example. And some people have put cultural perceptions, fear, and unfamiliarity among others. Yeah, that's very true. And I think in some cultures there is a very large pressure to do well and to appear as strong and confident, when it's very difficult to always be strong and confident. Especially in cultures, in certain cultures, you will often hear phrases like, man up or be a man, and that can very drastically affect boys and men who feel like they have a pressure to be a strong figure, and not cry, for example. It's those kind of things, which is some certain cultural things which are embedded into certain society, which can be very dangerous for some people. I can see someone's got a hand up. I don't know if you wanted to.
Yes, hi.
Hi.
So this is Sarah. I'm from New Jersey, United States. And I think it's a stigmatized because it's the lack of awareness about the subject, about the mental health in the society. So oftentimes people label these people, like these individuals who are going through mental illnesses, whether it's anxiety or phobias or anything that's mental. And they call them either, let's say, if they have depression, they say, oh, you're lazy. Or if they are anxious, they like, why you're anxious. They don't understand the underlying effects, why someone can get into that state of mind. And that's where the stigma comes in. And also when it happens from a lot of people around you, so you don't want to talk about it, or you just like pull back into your shell, and then you just think you're different, and they label you even as crazy maybe, or many things. And that's, I think it's because of the people are not aware of what mental health really is, and how it can affect anybody actually. And as we can see now with the COVID on the rise, a lot of people are anxious, stressed, and this all fall under the mental health umbrella.
Yeah, absolutely. Thank you very much for that comment. And I
Sure.
think it summarizes it very nicely. There is a pressure from lots of people, and people, do try and hide it because they don't want to be seen as, different. And people don't understand the underlying causes of mental health disorders. Sometimes people will say, oh, you're just being lazy, or you're not being, tough enough. You need to kind of toughen up. But people don't realize that there is actually a very scientific and medical basis behind mental health disorders, which is very difficult to control. So yeah, and we've got a lot more comments in the chat. People are saying, it's like an embarrassment. Some people, are embarrassed to, be seen as mentally weak. Someone's put, in this country, from archaic Victorian ideas about feeble-mindedness associated. So actually, I think that's very important. And we're going to talk a little bit about that on the next slide. In Victorian times, there were a lot of, people wanted people who were mentally ill to be kept separate from the rest of society. They were seen as kind of a danger to society, and they were, people who were thought to be lunatics were kind of kept aside in asylums, and that that was due to the idea of, you know, feeble-mindedness, weak-mindedness, as opposed to people who were strong-minded. And, you know, the kind of the shadow of that still remains in our society. Yes, and we've got more people saying it's hard to imagine when you don't have it, because it isn't visible yet. And I think that's also really important. That's one of the reasons, because, you know, if you break your leg or something, then it's very easy to see you've broken your leg. There's a clear, visible, you know, injury that's occurred there, and therefore, you know, people can't deny that it exists because it's visible. There's clear evidence that it's broken and therefore needs to be treated. With the brain, however, you know, it's much more hard to see these mental conditions, and that's why people kind of just put it down to laziness and that kind of thing. It's difficult to actually see the real changes happening. Yes, did someone have a something they'd like to say?
Why can't I hear it?
Maybe not. Okay. Yeah, we've got loads of people in the chat making comments. So we've got someone saying patriarchy. Yeah, and that does kind of link to the idea I was talking about before of the need for people to appear strong, the kind of roles that are embedded into our society, cultural reasons. Yeah, people don't take it seriously. And also in certain countries, in certain societies, there's an emphasis to do well in exams, for example, and that can, you know, have a big toll on children, especially, you know. So yeah, we've got, yeah, someone's talked about, especially in places where there's emphasis to put on your ability to perform your role, e.g. a woman who's depressed may not want to cook or clean or have children, and in extreme cases, people in the community may feel like she's no longer useful. Yeah, and, you know, gender roles especially can be very limiting in the way that people kind of are able to deal with their issues. Someone said, sorry, I joined late, what are we talking about? So we're going to be discussing mental health today, and mental health disorders. Yeah, so thank you everyone who's contributed. I think we've already had a really good kind of discussion about, you know, mental health and why it's such an important issue to talk about. We're going to move on to the next slide now and talk a little bit about the history of mental health before we look at some examples of, you know, kind of the ethical issues surrounding mental health disorders. So yeah, Siddhant, if you would like to take this one.
Yep. So we're going to be talking about history, and actually Shivas did touch upon this, especially when people were who had sort of mental health issues. They were seen to be crazy and they were sent off to asylums, which is obviously very it's very detrimental not only to their mental health, but as a society, it's very detrimental to see anyone who may have a mental health issue to be sort of outcast and ostracized, which is not how it should be, because everyone can suffer from mental health issues, and most people do at some point in their life have these have mental health problems, and that's you know, it's easily something people can do about it, but to ostracize people is clearly very bad. And in the 19th century, people with mental health issues, like I said, were sent to lunatic asylums, and the word that lunatic in itself is a very derogatory term, and you guys might have heard, I don't know, loony bins or many other words for sort of you know, mental asylums where they were being sort of they were sent for treatment, but it became a very derogatory thing. And actually I read this books which talked about the fact that asylums became sort of a place where people who didn't go to asylums thought that it was full of crazy people and sort of just sociopathic killers, murderers, people that were so ostracized, or so people that if you had any mental health issue, you were immediately someone who should not be in normal society and who would be highly dangerous, which is not true. Many people here were physically and mentally abused and received minimal treatment. The establishment of the NHS in 1948 attempted to abolish these asylums, although mental health services were still rarely offered by the NHS. Yes, so mental health awareness is actually quite recent, and I hope everyone agrees with me, but mental health is just as important, if not more important, than physical health, because even as Shiva said, and very rightly said, that although, you know, if you have pain in your legs, that's something you can, you know, it's quite tangible. You can see your legs, you can make sure there might be a bruise, you can see the bruise. and you can fix that. However, that's sort of a short-term pain. Mental health problems, and especially current mental health problems, are quite prevalent, like depression and anxiety. They can actually build up to even more detrimental effects than something like something like a broken leg or something like a bruise. So it's quite important that we deal with these as importantly and as with equal importance to something like a physical pain. And so I think it's a good development in medical sciences that we're caring about mental health issues even more. And in 1961, a scientist called Enoch Powell, in 1961, Enoch Powell, the Minister of Health, set out a shift towards care in the community rather than treatment in hospitals. So this was more of a societal approach. And the Mental Health Act 1983 updated the assessment of mentally ill people and their rights. The digitalization of society and increased pressure in schools and workplaces means that mental health is still a significant issue. Over 1 in 4 adults and 1 in 10 children experience mental health issues. And like I said, that just highlights the prevalence of such debilitating conditions. And it's something that talking about it and, you know, actively taking a part in trying to help people is a very effective cure, and something that needs to be made more aware. So I think personally, I mean, let's have views on this in the chat actually. What do you guys think about the shift towards more of a societal approach to helping people with mental health issues? In the chat, people said something. Okay, what do you mean by romanticizing? Do you guys think that mental illness is being destigmatized or romanticized in media? Oh, I see. It's not a good thing either. It causes triggers for loads of people. I was saying mental health issues can easily add up without you realizing. I'm not entirely sure what that word is. It is hard to go long times without taking care of physical health issues. Yes. Okay. I think. Yeah. Sorry, Shivas, you were saying something.
Oh yeah, I think the point about romanticizing mental health issues, but that's something we're going to talk about later today. You know, the fact that society can kind of promote or can lead to mental health issues, but also the fact that people are so, you know, becoming more and more aware of mental health issues. Sometimes that leads to people not really understanding what they are and kind of just throwing around mental health issues, or kind of just saying, you know, they have a mental health issue without really understanding the complexities behind it. So we are going to talk about that a bit later. Yeah.
Actually, I want to point out where I said it can trigger people. I think it's quite often confused. Triggering people could often be confused. Like I know people who take offense at when people say, you know, oh, I've got depression, or throw the word OCD around. And, you know, these people then everyone's like, you know, you don't have to get so triggered easily. You don't have to get so touchy. But I think one of the reasons people get so easily offended about that is because people may know people. I'm saying people a lot. People may know people who have these issues. And so just casually throwing words around like that might be offensive to them. And as you said, it's not good. It's romanticized in the media. I think to a certain extent that is true. Honestly, I think Shivas is more knowledgeable about that, and he will talk about this later in the presentation. But you know, there is some interesting research done into that. So yeah, good point to make.
Yeah, I think, you know, we can move on, but before we do, I just want to point out, I know, you know, in this country with the NHS, there has certainly been a push towards, you know, treating mental health conditions and more education about it. But I do know we have an international audience, so, you know, it's interesting. I wonder, you know, in your own countries, wherever you are in the world, whether, you know, it's similar there, and perhaps what you could, you know, be doing to try and promote more awareness of mental health issues, if that is not done, you know, already in your country, and just be aware that there are, you know, lots of different services available for these people. So yeah, it's something which is definitely becoming more prevalent in our society, and all societies across the world. But I think it's important to know that it wasn't always this way, and it's been very, you know, recent, the kind of push towards more awareness around it. Yeah, so we're going to talk now. The first thing we're going to talk about is body dysmorphia, and this is a mental health condition where people become, you know, concerned or anxious about flaws in their appearance. And I should point out that, you know, these are often quite minor things that other people generally don't even notice, but it's very, you know, people become very fixated on certain parts of their body, especially their face. And, you know, they become very concerned about trying to change their appearance or hide their appearance. And this is quite common, although it does have varying degrees of severity. All people are insecure about their appearance, and there are things that all people want to change about their appearance. And so it's estimated to affect one in 50 people, this kind of mental health condition where people are very kind of concerned about their appearance. And social media has had a large role in that, and that people kind of see these models on social media and they want to appear exactly like them. They want to be thin and slim and fit, but that's not always possible, and it's not something which should be achievable. It's not something which is achievable for many people, and it's important that people realize that that's okay and they should be happy with their own bodies. And so, some people who are unhappy with their bodies do try and alter themselves through cosmetic surgery. But, a study showed that, only less than 10% of patients who did go through with cosmetic surgery were, satisfied with the result. And, often people will, just become anxious about another part of their appearance instead. It's not really tackling the problem. Whereas you could argue something like, ensuring that this, helping ensure social media wasn't an area where people could, see these perfect bodies and be kind of drawn to having a perfect body. Maybe that might be a better approach at tackling this problem than something like plastic surgery. And plastic surgery does, of course, have its own risks as well. So the question we're going to discuss is, do you think the NHS should offer cosmetic surgery for purely aesthetic purposes? Do you think people should be allowed to try and physically improve their body to try and help themselves feel better about it? Or do you think that's just contributing to the problem and, the divide between people who are, who look perfect and those who don't? So I wonder what your opinions are on this, and if you could, put your ideas in the chat, then that would be great. We'll have a bit of a discussion around it. Okay, so we've got someone saying, I don't think so. I think that adds to the problem of comparing others. Yeah, and also, oh yeah, you've added self-esteem and growing confidence is more important. Yeah, and this is the kind of view many people have. They think that, if we didn't offer cosmetic surgery at all, if people weren't able to kind of improve their bodies, then it would help them learn to feel more comfortable in their own bodies. It would help them learn to be more confident and more accepting of people who have different bodies. Someone's added, based on the idea that less than 10% of patients are actually happy with the outcome, probably not. Yeah, and so, if we did have a society in which there wasn't such a need, if there wasn't an option for trying to improve your body, perhaps that would help people realize that, you don't need to improve your body, and that people should accept themselves for who they are already. I've got someone saying, obviously there's patient autonomy to take into consideration. However, it is just promoting the problem, as instead of realizing that you cannot really achieve perfection, you are just giving them false hope and letting them sit in the cycle of trying to attain perfection when it does not exist. Yeah, and autonomy is one of the main kind of the main arguments against this. People think that you should be entitled to improve your body if you want to. It should be your own choice, and sometimes it could really help in terms of mental health. If someone is feeling depressed, if someone is feeling sad about their appearance, and if they want to change it, then if they're given that option, that could potentially help treat that disorder and help them feel more confident. So cosmetic surgery could have the opposite effect. It could really help someone feel more confident, rather than forcing them to kind of become confident themselves, which not everyone can really do. Yeah, someone's put, the NHS is already struggling with a lack of staff and resources for patients with life-threatening conditions. This doesn't seem like a priority yet, and you have to look at it from an economic point of view as well, in terms of resources. You could argue that doctors who are specializing in cosmetic surgery, reconstructive surgery should, be used to treat patients who have been in fires or, accidents, rather than for aesthetic reasons. This isn't really a priority. This is more of a luxury, some could argue. Someone else has put, however, people may feel like they'll gain this confidence after the surgery they get, and they have the choice to do that as well to improve their mental health and well-being. Yeah, so that's what we're kind of talking about. Having the surgery could make, individuals feel better about themselves, but society as a whole, it's kind of just making the divide even greater. So we've got someone saying, I don't think so personally. Some cosmetic procedures can't be reversed. So what's currently popular and trendy now might not be later on. So when they might want to change to fit in with the current trend, which in itself is a vicious cycle. Yeah, that's very true. And people who kind of do surgery, we can see here that, less than 10% actually feel happy with the result. It could just lead down a path of people feeling, it could be just, temporary satisfaction with their appearance, and then going back to feeling, upset or anxious about their body again. Someone's put, this isn't sustainable because it makes future generations more likely to strive for perfection, and it seems like a never-ending cycle. The root of the problem should be addressed. Yeah, and that being, confidence about your own body. But what you've got to remember is that people aren't born equal. Not everyone has the same, some people do naturally have, are seen as culturally, attractive by, modern conventions, and other people aren't. And some people, will feel upset about their bodies, whereas other people won't. And perhaps you could argue that giving people the opportunity to kind of improve themselves and feel happy about themselves, is the right way of making people feel happy about their bodies, rather than addressing the root by stopping people from having these operations in the first place. Yeah, someone's put, if medicine is about saving lives, cosmetic surgery could potentially save a life if someone is suicidal because of their appearance. Yeah, that's very true. Prevention is better than cure. I agree. Let's tackle the root of the problem first. Okay, so we've got lots of people saying, we've got people arguing both sides. Many people are saying, they shouldn't offer it because that will lead our society to realize that it's not worth trying to improve your body just for aesthetic purposes. You should feel happy about your body, confident about your body, and on an individual basis, that certainly is true. But on a kind of general societal basis, that's true. But with individuals wanting to feel happy and confident, perhaps this could offer a solution for them. So there are points on either side, and you've got to take into account cost and autonomy and that kind of thing as well. Yeah, there's no real answer here, and for now, people are allowed to have cosmetic surgery, and some argue that it is a bad thing, but there are other ways in which we are helping people realize that their bodies are perfectly normal. So yeah, there's lots of different factors we have to think about. So yeah, we're going to move on now and talk a bit about doctors and mental health. So Siddhant.
Okay, so doctors are actually having, obviously most of you guys, I'm sure, want to be medical students, or even if you don't, about medical sciences, and possibly that's why you're here. So doctors actually have a very difficult job, not only physically taxing when you're constantly, having to perform at the highest level, constantly making good decisions and possibly the best decisions that you have to make ever for a person's life, constantly putting yourself before the patient. And that can actually also have a mental effect toll, because mental health toll on your mental health, because it's a very stressful job, and it's very rewarding, but it does entail a higher level of stress because you are having to make very difficult decisions constantly. So several studies have shown that doctors are at an increased risk of mental health issues such as depression. And this is due to the profession being stressful, having long hours, and very physically demanding, as I just discussed. And could mental health disorders like bipolar disorder, anger management issues, and psychosis affect the doctor's ability to treat patients? And therefore, as a follow-up question, should people with mental health issues be allowed to be doctors from an ethical point of view? I think we'll take this down one by one. So could mental health disorders like bipolar disorder, anger management issues, and psychosis affect a doctor's ability to treat patients? First of all, could we just in the chat have, what is every disorder? What is the specific definition, or what do you guys understand by every single disorder? Just so we know we're on the same page. So, for example, what does everyone know about bipolar? Could anyone put that in the chat? Bipolar disorder? Think about the word if you're unsure. Bi and polar, what do they mean? Any ideas? Just anything you guys know. Having manic highs and lows, severe mood swings. Yeah, okay. It's basically that it's your emotions and your state of well-being, emotional well-being, it fluctuates. And yes, exactly, as someone put it, extreme diverse emotion. And people can be really happy or can be really sad. And actually, there are documented cases where half of the year people may be happy generally, and the other half they may be sad or possibly upset or angry even. So it depends on many factors. Sorry, Shivas, do you have something?
Sorry to interrupt.
No.
Yeah, and it's not just, it varies for different people. It's not just necessarily happy or sad, but it could be a binary between, different emotions. I think often people say that it's between kind of a feeling of depression or depressive kind of feeling, a low and a high in terms of mania, feeling very overactive, feeling very ambitious. So it's not necessarily happy or sad, but it's just feeling very, energetic sometimes and feeling very enthusiastic, and other times feeling very depressive and, that kind of thing. And obviously that could have an impact in the way some people work if it's not, managed. Yeah.
Yes, exactly. Someone's put graphs. I mean, sure. Yes, I mean, I guess it, yeah. Chemical imbalance, sure. Could mental health disorder, okay, so the next one is anger management issues. I think this one's pretty straightforward, but could we just have 2 or 3 suggestions about what this might be? Or anything you guys know about it? Having strong feelings, getting angry easily when you can't control your anger and snap. Yes, so I guess it's more of being unable to hold your anger in, or maybe like dissipate the anger. Holding anger in is probably a problematic phrase, because you don't want to hold anger in. You want to be able to resolve it. So I guess not being able to dissipate or resolve the anger easily, I guess that could contribute towards things. Okay, and psychosis. This is I guess psychosis is another one. Let's move on to the next question, guys. Should people with mental health issues be allowed to be doctors? Can we try and have more of a complicated answer, or more put together answer for this, if you guys are willing to do that, or even if you just want to give simple suggestions? But what should people with mental health issues be allowed to be doctors? First of all, yeah.
Sorry. Try and think also from the 4 pillars of medical ethics as well. That might be a good way of arguing this in terms of what a doctor's duty is and what their role is in terms of treating patients.
Or if anyone would like to unmute themselves and talk for a bit and explain their point of view. Anyone?
Sure, I'll go.
Yeah. Okay.
Hi, this is Sira again. I think mental health, people who have mental health, and they are individuals who need help. And I don't see how those people will be helping others and be allowed to be doctors unless they are treated. I don't know. I think mental health is a ongoing situation, and if it's not treated, it can get even worse. So from ethical point of view, ethics, it's about the well-being of what you're doing as a doctor is like you are respecting and you're treating your patient to the best of your ability and in the right direction, right? So I don't see how someone who is not mentally fit will be able to help someone else in the same situation.
Okay, so I think that was a really good explanation because thank you first of all for offering
Sure.
that explanation. I thought it was really good. I think it's if I'm not wrong, I think that was deontology that you used there because you focused on the role of a doctor, which is to help patients. And if it's endangering a patient, if it's not helping a patient, then they're not performing the function correctly of a doctor. And so, and in that ethical point of view, perhaps doctors or, people with mental health issues shouldn't be allowed to help doctors. Now, just to play devil's advocate, and you can answer in the chat or anyone feel free to respond to either the first point that was made or to the question I'm about to ask quickly before we move on. What if someone becomes a doctor and then develops mental health issues? As we discussed, doctors are at a high risk of getting mental health issues. Or even what if their mental health issues do not prevent them from providing quality care? Because it is a documented fact that doctors do have mental health issues, and doctors can perform without their mental health issues getting in the way. And you have to realize it depends. There are two trains of thought here. Who's it better for? So who should be considered, the doctor's health or the patient's health? Because the doctors are responsible for the patient's health, but doctors, even if they can help a patient, maybe their health wouldn't be so good if they're bottling in these emotions and they have mental health issues, but are not letting it affect their work. And so, there are two trains of thought. There's no right or wrong answer here. It's a difficult decision, as those who have mental health issues, although it's quite discriminatory to not employ them, they may potentially put patients at risk. Priority is always patient safety. However, mental health conditions are finally and progressively getting treated in better ways. Treatments and responses to treatments has been improving generally. So I believe a doctor can be a patient and also treat other patients as long as they don't put the patient at risk. Even more interestingly, a doctor with a mental health issue, maybe not the extreme kinds, can relate better and empathize better with patients, improving patient care. Yeah, so I think that's a really key point, that it depends. And again, patient safety always comes first, non-compromisingly. That is the function of a doctor. But if they are healthy and if the doctor is unhealthy, then possibly for their own health, they should stop practicing, especially when other doctors are there to help out. The doctors at the end of the day are humans and do need the same emotional and health support that any other human does, including patients. We'll take one short last point and then we'll move on, okay? Doctors should be logical and offer the best options for patients. While it's difficult to ensure the doctors can hide their emotion in front of the patients and affect their patient's mindset when chatting with patients, doctors with mental health may not withstand with the failure they made. I'm not entirely sure what you mean by your final sentence, but I can see I can see the rest of it makes sense, that they shouldn't let emotions get in the way. And if they have mental health issues, if that's endangering patient care, then they should not be allowed to perform as doctors.
Oh, no, it's gonna be.
Thank you. Shivas, you want to move on? Oh, okay. Right. So we're going to talk about anorexia. I see we're running low on time, so I'm going to try not to waffle too much. Anorexia nervosa is an eating disorder where people attempt to keep their weight low by not eating enough food or exercising too much. Just to reiterate, this is a diagnosed disorder. This is not something that's theoretical. This does exist. You say yes, please, if you could. Yes. All right, thank you. So this is a scenario that we're going to walk through really quickly. A 15-year-old girl has come into your hospital alone. According to her notes, she's the average BMI for her age, and she is not at risk of any health problems. However, she tells you that she is concerned that she is too fat and wants you to prescribe her appetite suppressants. These are drugs that reduce hunger. You tell her the risks of these drugs, but she's adamant that she wants them. What do you do? Can we have suggestions in the chat, please? Or again, if you want to unmute yourself. I'll read through the chat, and if there's any points that I think are interesting, I'll read through them again. But what would you do? I think there's possibly one key point of information that you would want to relay to the patient here, which has been highlighted. But I want to see what everyone else would do after that. Anyone? Any ideas? I know some people might be taking time to write.
Okay. This is Sarah again, sorry.
No problem.
So, yeah. So, as you mentioned, anorexia nervosa is an eating disorder and it's considered a mental health. Now, the girl is a 15-year-old girl and she is a minor, obviously. However, in when it's related to mental health, they can do their own decisions. And that's an exception of a minor, being a minor. And here, what the doctors or the providers should do is like advocate for her and connect her to a social worker or someone who can not explain, but just help her to understand that or help her with her situation of this toe that she's concerned about being too fat, where she's not. She has an average normal BMI, right? And so that's what I would do as if I was a provider.
Right.
But again, the decision is her decision after all, because she's a minor. However, this being a mental health situation, she is entitled to her autonomy should be respected and her decisions.
Okay, right. Thank you for that. You mentioned,
Sure.
Sorry, just quickly, you mentioned that you were from New Jersey.
Yes.
I think it might be a slightly different system there because
Yes.
you mentioned she's a minor and you should connect her with a social worker. I
Yes.
think autonomy doesn't, I'm not sure if 15-year-olds in this country who can come along to the clinic are allowed to have their own autonomy unless they're assessed for Gillick competence.
In USA, it is. There are exceptions for a minor to be able to make decisions if it is only related to drugs, sexual activity, like sexual stuff, like if she's pregnant or whatever, and mental health.
Okay.
So maybe in the UK it's totally different. So that's why I wanted to emphasize that I am from the US, and that's where my answers, can be different.
Thank you.
Sure.
Someone said, actually, that's why I wanted to bring this up, because someone in the chat has said Gillick competence. And I think that's a really interesting point because, as you said, she's a minor and everyone's realized this, that she is a minor. And so it's very important to assess her competency in understanding the risks despite accepting patient autonomy. And you've said beneficence, would it actually do her any benefit? And I think that's the main point that's been echoed here, is that she's an average BMI, she's healthy, and she's not at risk of any other health problems. Giving her these drugs would do much more harm than good. And you can see from the wording of this question that it would have negative side effects. So I think right before we move on, I'd just like to say that it's very important to realize these drugs would be harmful. And so if you're in a position to say no to her, not to have these drugs, then if we literally just boil down the question to say, should these drugs be prescribed to the girl or not? Maybe autonomy-wise, possibly, because you have to respect the autonomy of the patient, but ethically, maybe not, because she's healthy and she doesn't need them. Shivas?
Yeah, we've come up with some really good points here, and obviously, in this situation, you would probably, assess the risks and benefits, whether she's competent or not, and her family's ideas as well. And we're going to move on now and talk about self-harm, which is actually an issue which is more common among people with mental health disorders. And there are a variety of reasons why people may harm themselves, although for people who haven't really been affected by this, it's sometimes difficult to understand why people might want to harm themselves. But usually it's because of trying to cope with emotional distress or making people feel in control. But there are a variety of reasons why people do this, and it can be very dangerous if it's unnoticed by doctors. So we've got another small example here. We won't spend too long on it because I'm conscious of the time. But we've got a 17-year-old boy who comes in to your hospital for an X-ray, and whilst you're examining him, you notice some scars on his wrist, and you realize that he's been cutting his hand due to stress over his A levels. And he begs you not to tell his parents, and tells you that they would become very angry with him. They found out he was harming himself, and afterwards, his parents say, "Come on, let's go home now." So, would you intervene in this situation? What would you do? Is it your role to intervene, especially if the patient doesn't want you to tell anyone? So just we'll just hear a few ideas before we move on. Yeah, so please do put your answers in the chat. Okay, so we've got someone saying, yes, intervene subtly if possible, like giving a leaflet or a number to call. Yeah, I think that's a good idea. If you don't want the patient, if the patient doesn't want to make a big deal out of it, but you should still try and help them in whatever way you can. You could, give them a leaflet, give them some information, tell them, come back here if you're struggling. Give them a phone number of a charity or something which could help them. And yeah, so that's a good idea. And it is very difficult in these situations because, as we mentioned before, the stigma surrounding mental health means that it's often very difficult for people, especially young children, to get help. Subtly, confidentially. Someone else has put, absolutely intervene, and it is. I think you've said because their life is in danger and you can harm themselves in this situation. So it'll be ethically correct to intervene and help them get the help they need. Yeah. So yeah, if you were arguing from non-maleficence, beneficence, those kind of things, then it would be your role to intervene and provide help immediately. Someone else put, advise them and help them understand that it's not the approach to take. Yeah, perhaps you could just say, oh, we need to, even if you don't make it obvious to the parents, you can say, I need to have a word with him quickly. Talk to him, say there are better options, there are people who can help you with this, there are better ways of managing it, and saying this could be quite harmful. I understand that it might help you cope, but there are more safer ways of doing this. You've put Sarah, I noticed you put, in New Jersey, we are mandated by law to report and to get them help. Right, that's very interesting. I'm not exactly aware of the law in this country, and I don't know how it is for those of you who are in different countries. But it would be appropriate, regardless, for a doctor to try and help the patient in some way, rather than just ignore it. Even though perhaps you could argue that goes against the patient's autonomy and decision to kind of not intervene. Yeah, so I think we should probably move on, considering the time. We've got still a little bit that we'd like to cover. Yes, Siddhant, maybe if we could just quickly go through the next one as well.
Sorry, if I may just say something a little short. Basically, this minor, she's doing that because there is an underlying situation, and that's what needs to be addressed. And that's where it's important to report it and get her the help. Because maybe she doesn't want to die, but there is something that's forcing her to do that as mental issues, So I'm sure if she gets help, then because I know someone who used to do that and they got the help with counseling, and now they are very good, and so not necessarily let them just continue with that and end their life. Yeah. Thank you.
Yeah, thank you. And I think someone else has put in the chat, what happens if a few weeks later he commits suicide? And that's very important from a doctor's point of view. If you do intervene, but perhaps not enough, that could lead to really negative consequences. So perhaps in my opinion in this case would definitely be to intervene and to try and go to as great a length as you can to try and stop them from harming themselves, because it can be very serious, and especially if it leads to suicide or an attempt of suicide. So yeah, I agree. I think it would be the correct response in this situation to do anything you can, even if it involves making the parents aware, because, you know, that would mean that perhaps the parents are able to help their child. I'm sure, you know, in this case, they would be very happy to try and help their child to stop them trying to harm themselves. And there is, you know, loads and loads of support and care that is available. So yeah, I think we should definitely move on now. We'll just quickly go through this slide about consent and mental health issues. Yes, Sidan?
Yes, so we've previously actually had a session on consent as well, and I think most of this stuff we already covered, but we're just going to run through it really quickly. The Mental Capacity Act helps determine whether patients have the mental capacity to make decisions of their own. This is where Gillick competence, you know, anticipated decisions, legally binding, you know, power of attorney, all of that comes in. Jane, age 75, has bipolar disorder. Most of the time, she can control her condition through drugs. However, sometimes she goes into depressive slumps where she feels very anxious and demotivated. She's been sectioned as such. Most of her medical decisions are made by a carer. After collapsing, Jane comes into your hospital with a lung injury. Jane is conscious and tells you that if she dies, she wants to donate her organs. However, Jane's carer tells you Jane opted out from organ donation a few weeks ago. Despite treatment, Jane dies later that day, and it is possible to harvest her organs. What do you do, and what is ethically correct to do at this point? I think there is a right answer in this. I'm not entirely sure, Shivas, what it exactly is, but I think there is legal precedence here, right?
Yeah, I believe, you know, in this situation, what would happen is, considering the fact that she has been deemed, you know, incompetent to make a decision according to this act, and due to the fact that she has already, you know, legally registered her interest to not donate her organs, unfortunately, you know, regardless of the wider benefits of donating her organs, which are kind of recognized, you know, it wouldn't be possible in this situation, you know, due to the fact that she's, you know, been injured as well. We don't know whether her mental health has been, or mental capacity has been damaged, or perhaps she's not thinking as she would in a normal situation. Yeah, we've got a few people in the comments who are saying stuff. I don't know if you want to go through those.
Yeah. What happens if a few weeks later he commits to? Oh, sorry, that was from previous. I think you wouldn't be able to harvest her organs because she might not have been able to understand what she said. Yes, exactly. So that was about the fact that she's not competent at the point, and actually she's deemed she's not deemed competent enough to make her own decisions, and therefore she has a carer making them for her. I totally agree, and there are legal documents that are filed and filled and signed. Yes, exactly. I mean, if she was competent when she said that she doesn't want organ donation, and now she's not competent, and yet she does want it, I think you take the decision that she made when she was competent, and I think legally that's the way to go. I think autonomy should be extended only if the person with a mental health disorder has been assessed with the capacity to understand what has been said. I presume by that you mean that if she was competent at time of death when she said she would like for her organs to be donated, then that decision should be allowed to be made. Is that what you mean? Even though she's revoking what she earlier said, but because she's competent, her decision should be allowed to stand. I presume that's what you meant. That's for the second question. Oh, right. Should autonomy extend to people with mental health disorders? Oh, right. Has been assessed in the class. Right. Yeah. Okay. So that makes sense. Yes. If they can understand what's happening, and if they're able to make a reasonable judgment based on the facts given to them, which is actually how competence is assessed as well. You give people information, you see how they can process that information and make a reasonable conclusion based on it. If they can do that, then yes, I agree with you. Autonomy should be extended, possibly. Yeah, I think, Shivas, if you want to move on.
Yeah, I think we probably should. We've got, you know, a couple more things we'd like to talk about. I'm aware of the time, but we'll quickly go through this. And this is something we kind of brought up at the beginning. And this is about faking mental health disorders. So, you know, as we've talked about, and as we hope we've made you aware, mental health disorders are extremely serious. And, you know, the brain is an organ just like any other, and it can be damaged, and it can cause illness, like any other. Although, the lack of visibility of this is why sometimes it wasn't treated as such. However, I've read a few articles about this, and it's about people claiming to have mental health disorders when in fact they don't. And this is sometimes due to, the need to kind of want attention, sympathy, and kind of seeing it as a trend, which is really quite, abusing what mental health is about and kind of mocking it in a way, which is, obviously very serious. And sometimes people do this inadvertently. They might just misunderstand mental health conditions. This is especially true for depression. People might just think, oh, I'm very sad, and therefore, I must have depression. And they kind of diagnose themselves with it without really realizing what it is, and without having a professional diagnosis. And this can, have very serious consequences for people who actually have mental health disorders if it's kind of become normalized for people to have mental health disorders. Especially on social media, you'll find people kind of throw around terms like, oh, my anxiety has become very bad, I'm so depressed now. And that can make people who actually have these conditions feel like it's common, and therefore it's not that important, it shouldn't necessarily be treated, everyone kind of has to go through it, when in reality these are very serious conditions. And so this is an example we've put together, and it's very tricky because mental health issues aren't visible to diagnose them. So I'll just read through it. A 24-year-old woman comes into your clinic demanding antidepressants, and she tells you that she's become depressed after splitting up with her boyfriend. However, you notice she doesn't exhibit many of the symptoms of depression. For example, she feels very lively and positive, which isn't, particularly common in people who have depression. And, she tells you that she's a social media influencer, and you realize that, she has a very lively lifestyle. She goes on expensive holidays and restaurants, lots of parties, and, you can tell she's in quite good physical health as well. Now, this is tricky because I'm not saying that a person like this can't have depression. Many people who do have depression are able to, not necessarily hide it, but they're able to lead, lives. They're able to, appear very happy and lively when, they are struggling with, certain, mental health conditions, and they do feel lonely at times. However, in some cases, a doctor may think that a patient is kind of faking it, or they think they're doing it as a trend. And, obviously we've talked about why that's dangerous. So the question here is, do you think patients should always be given the benefit of the doubt with mental health issues? Do you think if a patient says, I have depression, a doctor should always try and treat them? But, considering they're so hard to diagnose, do you think that doctors should try, nevertheless, to try and, use their judgment and think if a person isn't really showing the signs of depression, that they shouldn't treat them? And they should, kind of use their resources to try and treat people who perhaps do have very clear symptoms of depression instead. So, it's not a very easy question to answer because it's very difficult to treat something where there are no kind of clear physical symptoms. So I wonder what your, opinions on this are. If you could, please put them in the chat. I know it's 5 o'clock, so we will finish up quite soon. We've got some people saying, yes, if they can completely describe the symptoms, it might not be specifically depression, but if they feel something is wrong, they know their body something must be wrong, if that makes sense. Yeah, I understand what you mean. If this person, regardless of what their lifestyle is like, we don't know how they're feeling. They may very well have depression. And, if they do show some of the symptoms, if they can describe their symptoms, then, you are obligated to treat them. I wonder if, maybe we'll take one more point and then move on. And again, this is kind of the risk of social media. It is kind of romanticizing mental health issues. Sometimes, people do it for attention, which is very sad. Although, we've got to remember that most of the time we should definitely take it seriously, and not taking it seriously when it is a real case that needs treating could have, potentially disastrous consequences. We've got someone saying mental health provider is the one to assess her situation. Yeah, and someone's put, I think if they're not showing signs, then provide alternative options such as CBT, before settling on antidepressants. People are seeing it as an easy fix for their depression, but often it makes it worse. Yeah, someone else has put, I don't know if this makes sense, but I feel like sometimes it's hard to quantify mental illness. Just because the criteria isn't really met, it's not something you can properly assess, not like a physical wound. Yeah, and that's very true, because mental health is on a scale, really. It's not just like you have depression, therefore you need to have all the symptoms, you need to be completely isolated, lonely, you need to, that kind of thing. It is a scale, and we don't know, this person may very well be feeling, they may have symptoms of depression, but they're not particularly severe, or they may be severe, but they're good at hiding it. You're right, it's not something you can properly physically assess, but doctors who are specialized in mental health would be able to kind of pick up on the symptoms and the signs. So I think in this situation the appropriate response would be, someone's mentioned therapies, would be trying to talk to the patient, really understanding what's wrong and what the problem is. But sometimes they show as they're really happy, but they're not really happy. Yeah, that's very true. And sometimes people who have said they have depression, it comes across as quite surprising. People are surprised because it's not something you would have expected. And it's very, very important to make sure that you don't just judge people by the book, by looking at their symptoms and seeing if they match up. It's important to really understand. So I think in this situation, you would talk to them, you would attempt therapy perhaps before giving antidepressants, really understanding what the patient's needs are, understanding their life, and then helping them in whatever way you can. Yeah, I think we will leave the last slide, if that's okay, which was just about COVID-19 and the fact that it's kind of really had an impact on people's mental health. And I don't know what the situation is like in the countries you are in, but I obviously wish you and your families all the best. I hope that you're all coping okay, and if you are struggling, then obviously there are many online sites which are able to help. There are many people who are you can talk to, so I hope you all do cope well, and hopefully seeing this, we've already obviously talked about these issues from a kind of medical and scientific point of view, but they can affect all of us as well. So if you do need help or anything, then please do reach out. Myself and Sidon are always able to talk to you if you'd like to. But yeah, thank you very much for coming today. And if you do want to get in touch with us about anything in this session, if you'd like to kind of ask us any questions, then please do email us on our email, themedicaldebate@gmail.com, or our Instagram, themedicaldebate. Please do follow us. And yeah, we hope you enjoyed the session today. Sidan, I don't know if you have any comments you'd like to add or anything else.
No, I put it in the chat, but feel free to tell people to come, feel free to advertise the fact that you go to these sessions, invite your friends, send a link around, and thank you very much for coming. Yeah, I hope to see everyone next week as well. So thank you very much for coming.
Thank you.